Have you ever sat in the bathroom for 30, maybe even 60 minutes, feeling an intense pressure, but your body simply refuses to respond? You feel the constant discomfort, but nothing moves. Finally, you just give up and walk away frustrated, telling yourself you will try again later. But then later comes, and the exact same cycle happens all over again. If this sounds familiar, please listen closely. This isn't standard constipation, and a simple home remedy won't cut it. When waste gets physically blocked right at the exit, it creates a serious health issue that needs a real strategy. As a medical professional, I want to break down what it actually means when stool becomes stuck in the rectum. This condition is far more dangerous after the age of 60, and ignoring it can lead to severe complications. Today, I'm going to give you a clear, step-by-step relief protocol to fix this safely. We are going to talk about real anatomy and real solutions. It might feel a bit uncomfortable to talk about, but your health must always come first. If you have experienced this stressful situation even once, please type yes in the comments right now. Doing this helps boost the video so others know they aren't alone, and it brings this vital information to people who are currently struggling in silence. Let's look at what is actually happening inside your body. To truly understand why your body is reacting this way, let's step away from the medical textbooks and imagine something you can easily picture in real life. Think of a long, winding river that has flowed smoothly for years. The water moves steadily, and everything downstream gets exactly what it needs. But imagine that over a week or two, the water starts to slow down very quietly. Maybe there is a dry spell, or maybe a bit of debris begins to pile up at a sharp bend. The river doesn't just stop overnight. Instead, it slows down more and more until that debris packs together so tightly that the water literally cannot get through anymore. A massive bottleneck forms, and the entire system grinds to a halt. This is exactly what is happening inside your lower digestive tract when you feel this intense blockage. In the medical world, we call this condition a fecal impaction. While that sounds like a complicated clinical term, let's define it in plain English. It means a large dry mass of waste has become physically wedged inside your rectum, which is the very last stop before the exit. To understand how a simple bodily function turns into this kind of crisis, you have to look at how your large intestine normally works. Your colon is essentially a long, muscular tube. Its main job is to push waste forward while absorbing water from that waste at the same time. When everything is working beautifully, it is an automatic process. The waste moves at a healthy pace. The right amount of moisture is taken out, and the stool stays soft enough to pass without any discomfort. However, when things slow down for too many days in a row, your body's natural mechanics completely break down. Because the waste is sitting still in the colon for too long, the intestine keeps drawing out water over and over again. It strips away all the moisture. What was once soft and manageable gets baked by your own body heat into something hard, dense, and clay-like. By the time this dehydrated mass reaches the rectum, it has become too solid and too wide to fit through the exit. The natural muscular contractions of your body simply cannot push a cemented blockage out on their own. This is why standard rules no longer apply. And it is why the pressure you are feeling right now is completely real. Now let's talk about what happens when this hardened mass sits inside your body for too long, because a blockage like this can cause a chain reaction of hidden dangers. The first major issue is structural pressure. Your rectum is a flexible muscle, but it was never designed to hold a heavy cemented mass indefinitely. When the tissue walls are stretched out of shape for days, the heavy mass physically presses against the tiny blood vessels in the rectal lining. This pressure cuts off the healthy flow of oxygen and nutrients. If left untreated, this lack of blood flow can cause severe tissue irritation and deep sores that require medical attention to heal. But the dangers do not stop there. And this next part surprises almost everyone in my clinic. Your rectum and your urinary bladder are incredibly close neighbors, sharing a very tight space inside your pelvis. When the rectum swells up with a rigid blockage, it acts like a balloon inflating next to a garden hose, physically squishing your bladder from behind. This compression completely tricks your body. You might suddenly feel a constant, urgent need to urinate, find it incredibly painful to go, or even discover that you cannot empty your bladder at all. I have treated many patients who were absolutely convinced they had developed a sudden bladder infection, when the true culprit was actually a severe rectal blockage. There is one more hidden symptom that you must watch out for because it causes a dangerous misunderstanding. It is called overflow leakage. When a solid mass completely plugs the main exit, your upper intestines are still creating liquid waste higher up in your digestive system. That liquid has nowhere to go, so it begins to seep around the outer edges of the hard blockage, like water finding a tiny crack in a dam. It leaks out unpredictably, and because it looks exactly like diarrhea, many people make a critical mistake. They run to the pharmacy and buy anti-diarrheal medication to stop it. I need to issue a strict warning here. Doing this is incredibly dangerous. Anti-diarrheal drugs work by forcing your intestinal muscles to completely relax and stop moving. If you take them during a blockage, you will paralyze the exact muscles your body needs to fix the problem, turning off the internal conveyor belt and locking that cement-like mass firmly into place. If you have been struggling to empty your bowels for days and suddenly notice liquid leaking out, do not medicate it at home without a doctor's guidance. Understanding these cascading failures is the only way to protect your body from making a bad situation much worse. Now that we understand the hidden dangers, we need to talk about why this issue targets older adults so aggressively. The data shows that a severe rectal blockage does not affect everyone equally. It is a condition that disproportionately affects people over the age of 60, and the risk continues to climb with each passing decade. In fact, in long-term care facilities and nursing homes, studies show that up to 40% of residents struggle with this exact crisis. It is actually one of the most common digestive emergencies in senior medicine. To understand why this happens, we have to look at how aging naturally alters the human body. As we get older, 3 separate internal changes happen at the exact same time, creating a perfect storm inside your digestive tract. First, the rhythmic, wave-like muscle squeezes that naturally push food and waste through your long intestines begin to slow down. Second, the nerve pathways that tell those muscles when to squeeze become less sharp. At the same time, your body's natural thirst sensor becomes less reliable. This means many older adults are living in a state of mild dehydration without ever feeling thirsty. Beyond these natural bodily changes, common daily habits and lifestyle shifts play a massive role. One major factor is a sudden drop in daily physical activity. When we walk, stand, or do light chores, that physical movement mechanically shakes up and stimulates our internal organs, helping keep things moving smoothly. If you are forced to slow down due to a recent knee injury, arthritis, or a recovery from surgery, that vital internal stimulation vanishes and your colon slows to a crawl. Dietary changes also contribute, as smaller meals and a drop in high-fiber foods leave the colon with less bulk to push forward. Then, there is the massive factor of daily prescription medications. Many of the most common pills prescribed to people over 60 directly list a severe slowdown of the bowels as a primary side effect. This includes common blood pressure pills, iron supplements, heavy calcium doses, and certain pain relievers. When you take multiple medications together, their combined blocking power can completely dry out your system. Finally, we cannot ignore the power of social taboos. Many older adults grew up in an era where talking about bathroom habits was considered completely inappropriate. Because of this, when people feel a natural urge to use the restroom but are not in a comfortable place, they simply ignore it and wait. Repeatedly fighting that natural signal over many years actually retrains your rectum to stop sending the message altogether. The final warning sign disappears, allowing waste to sit completely undisturbed until it transforms into stone. Understanding these specific risks is the first step to ensuring this never happens to you again. If you are currently trapped in the middle of this painful situation, it is time to put a clear emergency action plan into motion. The very first instruction I need to give you, and I need you to hear this clearly, is to completely stop straining. I know every instinct in your body is telling you to push harder, but a hardened, dehydrated blockage simply will not respond to pressure from above. Forcing it only increases your risk of causing painful hemorrhoids, tearing the delicate skin, or triggering a sudden drop in blood pressure that can cause you to faint. Take a deep, calm breath, stop pushing, and let's handle this step by step. Your first step is to use adult glycerin suppositories, which you can buy at any pharmacy without a prescription. Because a rectal blockage is so dense, a single suppository usually isn't enough, so using 2 at the same time is often necessary. To medicine them correctly, lie down on your left side with your knees bent. This specific position uses your body's natural anatomy to guide the medicine directly to the blockage. Apply a generous amount of water-based lubricant to the area first to prevent irritation. Then gently insert the suppositories. Now, here is where most people fail. You must stay still on your side for a strict 30 to 45 minutes. Do not rush to the bathroom early. Glycerin works like a magnet, drawing water out of your surrounding tissues and into the hardened mass to melt its outer layers. If you move too soon, you will only pass the medicine, leaving the blockage completely untouched. If nothing happens after that first try, do not get discouraged. Get up and walk slowly around your home for 15 to 20 minutes. This gentle walking mechanically wakes up your intestinal muscles. After that, lie back down on your left side and repeat the exact same process with the second round of suppositories, waiting another full 45 minutes. Often, this second round is exactly what is needed to break through the core of the mass. If the suppositories still do not clear the blockage, your third step is to use an over-the-counter, warm water or saline retention enema. Administer the fluid very slowly while lying on your left side and hold the water inside your body for as long as possible. The goal here is to flood the area with moisture, loosening the top of the stubborn mass so it can finally slide out safely. However, if you have thoroughly completed all of these steps at home and still cannot find relief, it is time to cross the clinical line and go to an urgent care clinic or an emergency room. This is not a failure, it is a smart medical decision. At the hospital, doctors have access to high-volume medicated enemas that wash much deeper into the colon. If necessary, a specialist will safely perform a manual disimpaction, using lubrication to gently break up and remove the mass piece by piece under mild sedation. Relief is waiting, so do not let embarrassment keep you suffering at home. Once the blockage has been successfully cleared, either through your patient efforts at home or with professional help at the hospital, your body enters a very important recovery phase. It is vital to understand that your rectal tissues have just been through a major physical trauma. For the next 24 to 48 hours, it is completely normal to feel a sense of rawness, mild swelling, or even notice a few tiny spots of bright red blood when you wipe. Do not panic. This is simply a sign that the irritated tissue needs a little time and care to heal. To soothe this discomfort and speed up your recovery, your absolute best tool is a warm sitz bath. This simply means filling your bathtub with a few inches of warm water and sitting in it so your lower body is completely soaked. Do this for 10 to 15 minutes, 2 or 3 times a day. The gentle warmth instantly relaxes the pelvic muscles and increases healthy blood circulation to the area, which acts like a healing blanket for the irritated skin. During these first few days of recovery, you must also give your internal plumbing a well-deserved break by changing what you eat. This is not the time for heavy, dry, or highly processed meals. Instead, focus entirely on soft, easily digestible foods that naturally hold onto moisture. Think of a comforting bowl of warm oatmeal, well-cooked vegetables, ripe bananas, and clear broth-based soups. These foods pass through your system smoothly without forcing your healing muscles to do any heavy lifting. At the same time, you need to make drinking water a deliberate, scheduled task. Sip water steadily throughout the entire day, even if you do not feel thirsty, to keep your system hydrated from the inside out. Finally, while the memory of this painful experience is still fresh, you need to treat it as a wake-up call to look at the bigger picture. Use this time to schedule an appointment with your primary care doctor for a full medication audit. Bring a complete list of every prescription pill, over-the-counter drug, and supplement you take, and ask your doctor directly if any of them are secretly drying out your bowels. If you have a history of chronic bathroom struggles, ask for a referral to a gastroenterologist who is a specialist in digestive health. They can formally test how fast your muscles are moving. Furthermore, if you are over the age of 50 and have not had a recent colonoscopy, this is the perfect moment to get one scheduled. It is the only definitive way to make sure there are no hidden physical narrowings or growths blocking your path. Clearing the blockage was the short-term victory, but scheduling these checkups ensures you are protecting your body for the long haul. Now we have reached the most critical part of our conversation, because clearing a blockage is just short-term crisis management. Our real goal is to build a healthy daily routine so this stressful situation never happens to you again. Long-term prevention rests firmly on 4 simple pillars. Pillar number 1 is deliberate hydration. Water is the single most powerful tool your body has to keep waste moving. You should aim for at least 6 to 8 glasses of fluid every single day. If drinking plain water feels difficult, warm herbal teas, vegetable broths, and juicy fruits like watermelon or oranges count toward your daily goal. Set a timer on your phone if you need a reminder, but make drinking fluids a non-negotiable habit. Pillar number 2 is mechanical movement. You do not need to lift weights or run a marathon to keep your digestive tract healthy. Simply taking a brisk 20 to 30-minute walk every day is one of the most effective ways to wake up a lazy colon. If walking is difficult due to joint pain, gentle chair exercises or swimming work just as well. When you move your body, you mechanically stimulate your intestines to keep squeezing waste forward. Pillar number 3 is dietary consistency. Gradually add soluble fiber to your meals using foods like oats, beans, and cooked vegetables. Fiber acts like a sponge, absorbing water and adding healthy bulk to your stool so it stays soft. Just be sure to add fiber to your diet slowly over a few weeks to avoid sudden gas and bloating. Pillar number 4 is establishing a scheduled bathroom time. Your body has a natural morning reflex that triggers the urge to empty your bowels within 30 to 60 minutes after eating breakfast. Capitalize on this by sitting on the toilet at the exact same time every single morning, even if you do not feel an immediate urge. Use a small footstool to elevate your knees slightly, which aligns your rectum in the perfect position for smooth elimination. Give yourself 10 minutes without rushing or straining, and your body will slowly relearn its natural rhythm. Whatever you do, please avoid relying on daily stimulant laxatives as a quick fix. Over time, these pills train your colon to become completely dependent on artificial help, causing your natural muscles to forget how to squeeze on their own. Instead, speak with your doctor about safer, gentle alternatives like stool softeners or fiber supplements. I know this was an intense conversation today, but talking openly about our health is the only way to protect it. Please take a moment to type your age and your current bowel habits in the comments below. I personally read and reply to every single comment to help guide you. If this video gave you the practical answers you needed, please hit the like button and subscribe to the channel. Most importantly, share this video with a friend, neighbor, or family member who might be quietly suffering in silence. Let's look out for each other, drink our water, move our bodies, and take real control of our health. Thank you for watching. I will see you in the next video.